Hello, everybody. I'm Dr. Steve Karstensen. I'm Chief Dental Editor of Dental Sleep Practice, a MedMark publication. Welcome to the presentation and Q&A with Dr. Jonathan Ford. In our webinar today, we'll be discussing how to reduce administrative tasks, minimize adjustments, and improve patient satisfaction with Biomatch by Panthera Dental. We all want to provide good oral appliance therapy for our patients, but we oftentimes need to overcome these barriers, and Biomatch has helped us. Before we get started, I'd like to invite viewers to use the Q&A to ask any questions. They'll be answered through the course of the presentation and after at the end. And if we have any additional questions, we'll be able to answer those later as well. Now, I'm pleased to introduce our speaker. Dr. Jonathan Ford graduated from the University of Pennsylvania School of Dental Medicine with honors in 2007. He has a general dental practice in Huntington Beach, California, with a focus on dental sleep medicine. Dr. Ford's a diplomate of the American Board of Dental Sleep Medicine, as well as a resident faculty member at CDOCS. He's certified CEREC trainer, alpha beta tester for Dentsply Sirona, Kyorai Noritake, and serves as clinical advisory board member for Digital Arches / OptiSplint, Neosis Yomi, and Panthera Dental. Firm believer in leveraging digital technology to give his patients the best possible treatment outcomes. Thank you so much for joining us, Dr. Ford. Now I'm going to turn the webinar over to you. Be so interested in what you have to share with us today.
All right, well, thank you for that wonderful introduction. I'm here tonight to talk about Panthera's appliances, the multiple types of appliances they have, and also discuss Biomatch and their design philosophy behind making each of these appliances. And I'm honored to share with everyone that we're going to be simplifying the ordering process with Panthera now, and what information they need, so we don't need to be sending the order through our different type of portals that we have, and then also then going to Panthera Dental. We can now seamlessly submit the information, submit the case, and they're going to be off and running. What I like to show in all of my lectures is this quick video. It's very simple. It's follow the directions on the screen, and it's how many passes does the team in white make? And if we're paying attention, hopefully we all are, we know the answer is 13. But I want to rewind the video real quick because I want to see if everyone was also seeing the moonwalking bear. So we're going to rewind it. And about 5, 4, 3, 2, 1, if we're taking a kind of a bigger picture here, we see the moonwalking bear. And why I love this video, because I think it epitomizes, yes, it is easy to miss something you're not looking for, but another mantra that I have is the eyes don't see what the mind doesn't know. I think that definitely applies with, I think, a lot of general dentists out there. If we're not looking for the nuances of the teeth and the soft palate and the tongue, we miss out on sleep. But what it also does, and that kind of gets into the learning objectives for tonight, is my goal is to kind of educate you to maybe see appliances differently, to see how appliances put force, not on all the teeth, but on certain teeth, and how that can then have an effect on outcomes, on bite changes, and how people tolerate these appliances. We're also going to talk about, yes, I've already hinted at it, but Panthera's Biomatch single-step ordering and what we need to do and how do we get this in these appliances out of our offices, whether digital or analog, and back into our offices and into patients' mouth as quickly as possible. We're going to talk about the technology that Panthera have and what does actually Industry 4.0 manufacturing mean. And then all the actionable steps that we can use to do Biomatch. And I think it's going to be pretty simple on how we can save time. And when I mean save time, we're down to a few clicks. And I always say, when I get asked to alpha or beta test something, I'm literally down to how many clicks does it take me to do? And how simple can this be? Because the more clicks, the more complex it can be. So with Panthera and my experience with them is I want this appliance to fit the first time. I want it to be done the right way. I want it to fit and drop in without any adjustments. And that starts to build confidence with my patients. But I also want that appliance to be in there for as long as possible without any breakages or fractures or appliances that I have to send back. And if I do, because I think if you do enough sleep appliances, you're going to see something break in some way, shape, or form. I want to know that I am covered, and Panthera has my back as well. I also am going to talk about essentially side effects and how do we mitigate these. And I think appliance design is going to have a huge impact on potential side effects when we talk about that dreaded occlusal change. Yes, it may happen, but how can we mitigate these forces that we put on these teeth to then mitigate the side effects and the occlusal changes? And I know occlusal changes is a big, broad concept. Is it the whole jaw moving? Is it certain teeth moving? Or are there certain contacts? And I think that all goes back to appliance design to create a repeatable, efficient, effective appliance with good results for our patients. So let's talk about what I think is something simple, but I'm going to use a lot of analogies tonight. And the first analogy is if I go up and I'm pressing against the wall, that wall is going to be exerting a force against me. But if I go up to that wall and not quite touch it, there's no force being exerted back on me. So even though I'm close, there's still no force. So if there's no contact point, there's no force is the first principle that I want to think of. But then I'm going to add, say there's a whole bunch of people behind me and we're all pushing against the wall. I think it's safe to say, with using this analogy again, the first person here that is pushing against the wall is going to be exerting a lot more force than this last person. Okay? So why I'm using this analogy is now we're going to take the wall away and let's put a tooth there. And the paradigm shift that I first had to think of was I thought I wanted to splint all these teeth together with a hard, rigid appliance, and therefore it was going to keep all my teeth together, and I was going to have no tooth movement and therefore no side effects. But my thought process and my paradigm has kind of shifted a little bit. And I'm going to show you research tonight that shows that yes, where this first person is and where this first tooth is, that is where there's going to be more force. So what I like to say is wherever the attachment apparatus is, wherever the hook, the rods, the bars, wherever that point is on that particular appliance, whether it be the maxillary canine region or the mandibular posterior, or if it's in the maxillary anterior, wherever that connective point is between these two retainers is what I'll call them, pushing the jaw forward, that tooth or those teeth are going to have more forces put against them. And then we start lining up all these teeth in a line. And remember, it's not a straight line. We have like a horseshoe with our mouths. It also is what direction are these forces being placed on, or what directions or vectors are these teeth being put on? Is it, let's say, the mandibular anterior teeth? Which way will I think they will move very easily? And that's the labialization of the mandibular anterior teeth because there's really no pressure there. Or like a maxillary terminal molar. Which way do maxillary terminal molars usually like to go? They like to drift distally. I always joke, it's never happened to me, but for these cases where I've done a crown prep, closed the contact, and then 2 or 3 weeks later or 2 or 3 months later, the patient's coming in and saying, I have food stuck up in there, and you look, and there's like a canyon in there where the tooth is suddenly shifted. So I would not only want to look at what teeth are we putting these forces on, but what direction are we putting these forces on these teeth, and which way are they going to move the quickest or the easiest? And then I think this brings me back to dental school is what teeth are the strongest and what teeth are the weakest. I remember in dental school, it's always the canines, and maybe you want to interchange the maxillary or the mandibular canines. I'm okay with that. But I think the general trend is the canines are the strongest. Then we go to the mandibular molars. I just used that analogy. I think the mandibular molars are a little bit stronger than especially the maxillary terminal molars. Then there's the premolars, and then the teeth that I think are already fragile in general are the maxillary incisors and the mandibular incisors. It's like, where would you feel comfortable putting a bridge in the mouth? Are you going to feel comfortable using a canine as an abutment tooth? Yeah, I am. Am I going to use a mandibular molar or a maxillary molar? Yeah, I am going to. But I don't really want to start putting pressure or putting a bridge on my mandibular incisors. So when I walk you through this thought tree or this thought process that Panthera is creating with their biomatch principles, this is what they're thinking. They don't want to put forces on kind of the weaker teeth, and they want to put, if we do have to put forces on teeth, on the stronger teeth. So this then goes back to what is a force? A force is a push and a pull. It is measured in newtons if we're going back to physics here, or bioengineering principles. And every force is going to have an equal and opposite force. So the wall that I was pushing against when I use that analogy, the wall is then exerting a force back on me. And all of these forces are going to travel through teeth, joints, muscles, but they have to travel through contact points. So if the appliance isn't touching a particular tooth, there's going to be essentially zero force put on those teeth. So when you see these design principles that Panthera is using with their biomatch, that's what they're doing. They're putting, if they're going to attach the appliance to a tooth, they're going to try to essentially put forces on strong teeth, not putting forces on the weak teeth. Now, I am a big believer in digital technology and digital scans. If you come to my office, I very rarely use PVS impressions. And it kind of thought back to digital scans and why we use them, and it's just the predictability of it. And like I can't imagine on these patients that have a big tongue, gag real easily, trying to take a PVS impression and getting every single tooth immaculately perfect on the first time. And now we have to do that on both the upper arch and the lower arch. And then we're going to go ahead and mount these cases in a anterior protrusive position. And I'm going back to my dental school days when we had to mount models in maximum intercuspation on semi-adjustable articulators, and we have rubber bands, and we have like tongue depressors with wax trying to mount these in maximum intercuspation. That was still hard and very, still an inaccurate process. Now add that if we're going to be taking records for a mandibular advancement device in an edge-to-edge position, these jaws are now floating in space and we're trying to mount them. So if there's any discrepancy in any way, shape, or form, that means the appliance isn't going to fit right. But with the ability of the digital scan, if they're gagging and we need to take a break, we can restart that scan. And that bite, we can get it at that moment in time when we have those models perfectly mounted in space without any discrepancy. And that's just been my experience. When I send it digitally, things are locked in and I know this appliance is going to fit. And now there's research backing that as well. And this shows that when participants usability scores, so when patients get delivered a mandibular advancement device that is digitally manufactured, these appliances fit better, and therefore the patient uses them more often and can tolerate them at a much higher level. So with Biomatch and Panthera, they are open to any system out there. You can send them direct through the portals with Dentsply Sirona, Medit, 3Shape, Itero, Dexis. If you don't have one of those scanners, you can even export an STL file from any of your intraoral scanners. And then you can send that and upload to Panthera Dental's website. So Panthera has two different appliances. They have the X3, which is a winged push type of appliance. When I typically use that is with posterior crossbites, absent or fragile short lower molars, absent fragile short upper canines. And then my favorite and my go-to for a majority, if not all my appliances is the Panthera Classic. It's a tendency if you're an open mouth or mouth breather, it helps promote lip seal, nasal breathing, closed mouth. There is some research that shows that it is helps relieve some pressure on the TMJ joint, and I will show you the research behind that. If you have a large tongue, you're able to customize the appliance and get rid of some of the 3D printed nylon material in the maxillary anterior region. And then again, when I went back to look at where the connectors are, or where they are, and look at if you have teeth where the connectors are, this appliance is going to work well. So in this particular case, the connectors are near the maxillary canines and the mandibular molars. So if you're missing teeth in the opposite areas, then you're going to use this appliance. And if you are missing the exact opposite where the X3 here is, if you're missing or have those teeth in the canine, the maxillary posterior and the canine region for the mandible, then that's going to work for you. So the other great thing about the Panthera Classic, it is a PDAC approved appliance. So we do get Medicare to cover this appliance. But let's talk now about Biomatch and what their thought process is and their design philosophy to give us the best fit and the highest tolerated forces. And it all goes down to mitigating forces and putting, if we do have to put forces on teeth, putting them on the strongest teeth and minimizing unfavorable forces, or hopefully eliminating forces on the weakest teeth. So Biomatch now is a single step ordering process. All we have to do is in our prescription with the intraoral scanner that we're using, we need to put 4 specific items into that prescription that I will show you on the next slide. But I want to talk about what is Precise 4.0 manufacturing. Precise 4.0 manufacturing means it is an additive technology. We're not wasting any materials. So we're not carving out of acrylic. We're being additive and using as little material as possible. So we're 3D printing. They're using CAD/CAM design. They're using autonomous robots. So robots are moving these appliances from the printer to the curing units to be polished. So there is machine learning that's going on with this, with robust cybersecurity, HIPAA compliant data. So it's not your traditional dental lab when you go in there and you see these little buckets being taken from the metal or the zirconia, and then the zirconia goes to the ceramist, and you're seeing someone take this little bucket of a crown every which way. It is all autonomous in this particular facility. And it is all streamlined. So every step along the way, they know what's going on. And if you need an update on where this particular appliance is, they're going to know exactly where it is. But Biomatch and Panthera also give you the options to customize them if you want to. And nothing's going to change if you like the current workflow with Panthera and Biomatch and sending it digitally or sending it analog, and then you want to go fill out the prescription and customize the appliance, nothing's going to change. So you can continue to do that. And we're going to go through some of the options that you, if you want to, and you want to customize it, that you can continue to do. And then we'll go through if you have specific issues or specific concerns for the patient. A tooth is loose, or we can't put pressure on a cantilever bridge or something like that, what they're going to do to help implement that. So Biomatch now, and this is the big thing that I get to announce, is it a single step ordering and design. What you need to do in the prescription is you need to give Panthera your 4-digit customer number. You need to tell them what tooth is fragile, what crown is fragile, if there's a pontic, if there's a cantilever bridge. And I think you could go a little bit deeper too, is can this patient just not breathe through their mouth? Or sorry, excuse me, can't breathe through their nose. They have deviated septum. They have sinus surgeries. They just have a broken nose and they need to breathe through their mouth. Panthera can customize something for you. If you have a big time bruxer who has broken every tooth in his mouth, or has broken every porcelain that you've put in there, or every crown that you put in there, or broken every single night guard that you've put in there or worn through it, they can create a customized type of appliance for you. You also need to tell them the type of bite that was provided. Are you essentially the George gauge or whatever you're doing to set their position? Is it all the way to the maximum? Or is it at a starting point and then you want to be able to titrate it for them? And then what type of appliance you need. Those 4 things need to be in the prescription when you send it via any of the intraoral scanners that you have. What they're going to do is that they're going to use their Biomatch principles, design the appliance for that particular patient, customize it, need it to the best of their abilities. They're going to be able to manufacture it with that unique manufacturing facility within 8 days. And then the nice thing as well, and I think this is also new, 36-month warranty for any device, free of charge, 0 questions asked. So if something does break, I know that I am taken care of and the patient is taken care of as well. But let's go back into what do they think of when they're designing these appliances. And the first thing is they don't want to engage in any undercuts or any embrasures or any interproximal. And how I use this analogy is, when do we use wedges in the dental space? We use wedges to lock into the gingival embrasure to open those teeth just slightly. So when we take that wedge out and we're doing a class 2, that contact is nice and tight. But if we're creating appliances that are like a ball clasp here, that are engaging that embrasure or engaging that undercut, that is a potential to create a change in the bite, or a change in the, I shouldn't say a change in the bite, but a change in that movement of that particular tooth to either create an open contact or potentially a diastema. So what they want to do with their proprietary CAD/CAM software is look at the undercuts and create enough undercut or grooves or capture with the 3D printed nylon material on the buccal or the lingual. They do not want to engage the interproximal of these teeth, and they're able to do that using their technology. Okay? We also then can customize it. I'm going to go through what the most common one that they're going to design in that biomatch principle, but then how they're going to design certain appliances given certain scenarios that you may give them. So you can create a band that only goes on the facial. You can go create a full wrap. You can call what I will call 3/4 on either the buccal or the lingual. You can call just the lingual, and all the different variations. So a lot of different variations that you can do on both the maxillary and the mandible. But you can also do it here with the plateaus and how these appliances meet each other. Is it going to be full on full, lateral on full, lateral on lateral, anterior on lateral? So you have a lot of design options if you want it, and this is the protocol that's been out there. But I'm going to go through when I use each one. So the first one is this lateral on full, and this is the most common. So if you're not going to say there's any fragile teeth or they don't brux a lot, it's just your normal patient without any major issues, you're going to get a lateral on full. Most common variation gives a little bit of anterior opening, minimizes the pressure on the posterior, taking some pressure off the TMJ, and then the lower full means it is a nice rigid device, and that protects against any lingual movement of the lower molars during any lateral movement. Full on full, I typically don't use a lot, but if you need to, you can, and that's when you need a large surface of contact area because the teeth are usually pretty short. Now we have the anterior on full, which I'm going to get to a little bit more on when I use it on the next slide. But then you also have the lateral on lateral, and that creates a nice hole in the anterior. So if you do have someone that's completely nasally congested for whatever reason, this allows them to mouth breathe if you have to. And you can see here all these options that I just showed you. This is for the Panthera Classic, but all of these options can be used for the X3 as well. Okay, so able to customize both type of appliances. So when do I use the anterior on full, and how do, again, I'm going to use another analogy. If I have that big time bruxer that has broken everything, how do I limit how much force they can put on this appliance? And one of the analogies I heard way back when was take 2 marbles, put them between your 2 fingers. You can generate a little bit of force. When you take 2 bottle caps or 2 soda caps and you squeeze them between your 2 fingers, you can generate a lot more force. The more surface area contacting, the more force you can generate. So if you have someone that you're trying to mitigate how much force they're putting on it, let's put that the marble analogy back in play, and let's get an anterior on lower full, and all they're touching is their anterior teeth. They can't generate as much muscular force. It's 20 to 30% their maximum biting force, compared to if you get a full on full, that is 100% bite force, and a lot more pressure goes onto that appliance or onto the teeth and onto the mascatory environment in the TMJ joint. So these are some of the things that you can give Panthera, and goes into their, I'm not going to call it an algorithm, but their decision tree when making these appliances, or what you can then take over if there's a particular case that you need it for. Now I'm going to focus back on that Panthera Classic device. The traction device And when I talked about some of these forces here, you're going to see 10% force, 30% less force. These forces may not be great, but it's all going back to force mitigation. How do we decrease the force to the best of our ability? And if it's a 5% decrease, a 10% decrease, a 30% decrease, these are all things that help then hopefully mitigate side effects for these patients. So we have on the next couple slides, we'll go through the traction-based device and 10% less and how they get that. So point number 2 is aligned with the occlusal plane. When we have this appliance in parallel with the occlusal plane, there's 30% less stress. The masseters and the lateral pterygoids are in harmony. We then go to the incisor contact, and if we don't have a contact point, the appliance is not touching those incisors. Therefore, they shouldn't have any force being put on them, and therefore they shouldn't be moving or changing. And that's where I think this big paradigm shift with overjet and overbite, if we can mitigate the forces on the mandibular and maxillary anterior teeth, we can then hopefully mitigate overbite and overjet changes. So over the next couple slides, we're going to go through each of these 3 points. So we're going to go all the way back to geometry here and the Pythagorean theorem. And in engineering or biophysics principles, wherever the longest line is, it's going to have the most force put on it. So when we look at the Panthera device here, it has this subtle little design change. It has this little notch that goes up, and then you have a force that goes, in this particular case, vertical. What they're trying to do is they're trying to get rid of the hypotenuse, the diagonal line. Wherever the longest line here, the longest line is going to have the most force put on it. So by getting rid of that diagonal line, they're then decreasing the force that is being put on the forces of the teeth. So again, when we talk about 30% reduction in forces here, you can see the 13.87 newtons versus the 9.81 newtons. So again, subtle design changes or subtle design features in Panthera's biomatch principles start to decrease forces here. Another one when we talk about why can we decrease forces by 10%. And I think this came to me at the gym when I was doing my lateral arm raises here. If I have a 5-pound dumbbell and I'm holding it either straight up or straight down, I'm working in harmony with gravity. It's not that hard. But as soon as I move my hand out to the side, that 5-pound dumbbell becomes significantly more challenging for me to lift. When we talk about essentially this appliance and getting the occlusal plane as parallel as possible and moving the jaw in that occlusal plane, it's this same principle. As soon as the jaw starts to hinge, gravity starts to take an effect, and it's subtle changes. 41 newtons applied versus 37 newtons applied. 4 Newton difference, about a 10% decrease in the amount of force that we're putting on these teeth, these jaws, these muscles. So it's again, force mitigation, decreasing the forces as best we can. And then let's talk about the rods and the connecting points. When we're moving the mandible forward, we're still exerting a certain amount of pressure, the same amount of force on these teeth when I bring it out. But if we have 2 rods here or 2 connector points, that is then one side is taking half the pressure, the other side is taking half the pressure. If we have maybe 1 connector point, that 1 point is then putting a lot more pressure on those particular teeth. So this is now where the research starts to come in and actually show us. This central connector here, a tap appliance where we have the connector right in the maxillary anterior teeth and the mandibular anterior teeth. It's putting 600 kilopascals on these particular teeth. But when we go here to the lateral connector, again, 2 connectors, half as much pressure, we're getting 300 on one side and 300 on the other. Still, the total force is the same, but half on each side. And then look at where these connectors are. That central connector is putting a lot of forces on the maxillary anterior teeth and the mandibular anterior teeth, and it's putting 600 kilopascals there. Versus the lateral connector, I think in this case, it's a herp style appliance. It's putting some force on the mandibular canines, maybe some force on the mandibular anterior teeth, putting some force on the maxillary, but half as much force. So it's being divvied up. When we go to this other side here, the right side of this slide, it's a lateral connector. Again, two connectors, therefore, you can see by the numbers, almost half as much pressure is being put on these stronger teeth. And then we kind of call this the hybrid connector, the Somnomed Avant. And I will call this like 1.5 connector points because it has that rod that goes around. It's not two separate ones, but it's again putting force on the maxillary anterior teeth and the mandibular posterior teeth. And it's 1.5. So yeah, it's still putting a little bit more force because a lot of that force is going on the maxillary anterior teeth. And it's typically areas that I don't want teeth to be put on. I also want you to think of what direction are these appliances then putting the forces on these teeth. And typically when I see a push style appliance, it's going to retrocline the maxillary anterior teeth and labialize the mandibular anterior teeth, and then we start having overjet issues. Okay? And again, that's what you see here when you start looking at the research, is not every appliance is the same. All of these design features are going to have an impact on these teeth. I always call it like the Doppler radar. When you see red on the weather report, it's bad. So when you see red for a central connector on the mandibular anterior teeth, a little bit of yellow on the maxillary anterior teeth, it's not typically what I want to see. I don't want a lot of forces put on those teeth. Again, the lateral connector here, maxillary posterior teeth, maybe pretty much spread out along the canines, which I'm good at, but you start to see a little bit of color starting to show in the lower mandibular region. And then where are they directing these forces? It's a distalizing force on the maxillary terminal molars, which I already said is not a good recipe for success on trying to keep these teeth in the right position. When we go to lateral connector here, we have forces on the maxillary teeth, but also pretty even on the mandibular teeth. So again, I like when I don't see a lot of red. And then this hybrid connector, it's putting that lingualization of the maxillary anterior teeth and putting a lot of force on those. And that's, again, not where I want to see these forces. I want to see a lot of blue, a lot of green, not the red. And then look at where the red is. If there's a lot of red on weak teeth, it's kind of not what I ideally want. Again, another research paper kind of showing the same thing. If we're going to focus on the herp style appliance, distalization of these molars, distalization of molars, labialization of the mandibular anterior teeth, and this is not the movement that I want, okay? Now, when you start to see the DSAD classic appliance, all of a sudden you don't see any forces at all on these teeth because they're not engaging those teeth. Yes, we can put forces on the mandibular posterior teeth, but what direction are those forces on? And a lot of times when we're jutting the mandible forward, it's creating a mesialization of those mandibular molars and pushing them against all these other teeth here. And that's something I can live with. We're going to put forces on these maxillary canines, and we're going to create a distalization of these maxillary canines. And again, that's a force that I can live with. I look at orthodontics and how they've done class 2 corrections for years. They've put elastics, and where do they put those elastics? They usually hook them on the maxillary canines, and they put them on the mandibular molars to create that mandible to foster it to grow forward. So that's the appliance that I kind of like to live with because it puts forces, as minimal of the forces as possible, on kind of the strongest teeth, which are the maxillary canines, and in this case, the mandibular molars. Now, I think this is where I think it's been ingrained in any dental sleep medicine practice, is that over years and years and years, we're going to see overjet and overbite changes, and we're going to see a decrease in both of those over time. And I think this is a paper that a lot of people quote. There's another paper here that goes into, I love this paper just because I always, CPAP can change over jet as well. You looked at the Somnomed appliance, you look at the TAP appliance. What appliance had the most changes in overjet? It's the appliance that puts the most forces on those maxillary anterior and mandibular anterior teeth. And what direction do these teeth want to move? They keep going to run into each other. If they run into each other, then we could create posterior open bites because we have premature contacts in the front. And then I think this paper just came across my desk today, and I saw it and I was like, this makes sense and we need to put this in here. But again, another research paper that shows that over long term, and we'll read it word by word, in long-term oral appliance treatment, both overjet and overbite gradually decrease over time, which was predominantly from the retroclination of the upper incisors and the proclination of the lower incisors. It also shows that skeletal changes were typically not significant in the anterior or vertical dimension. So that's great. But I also liked what they said if you dig into the research and the limitations, is if you go through here, it says that we need to start looking at what type of oral appliances were they using. And yes, there are certain appliances that are going to create more overbite and overjet changes. And I think this research paper is where I had a major paradigm shift, okay? And it took me a very long time to kind of figure this and gather this in my head because it was so ingrained that all mandibular advancement devices decrease overbite, decrease overjet. And we're now starting to see papers come out that actually say the opposite for this bilateral pull, bilateral traction device, okay? And the best way I can describe this to you is get one of these appliances in your hand and start taking them apart and putting forces on them and see how the appliances bend and move and what ends up happening because it's going to create a force on these teeth. But what it's starting to show, and I know this may sound shocking to a lot of you, is that bilateral traction devices could actually increase overjet and increase overbite. And when I show this to you, the best way I can show you is hold these appliances, push it down, and you're going to see this traction force on the maxillary teeth. It's going to be generated by the rod on the connection point at the canine, creating a lateral posterior closing force. So it's going to bring these maxillary teeth potentially in and create possibly a flaring in the maxillary anterior teeth. But to mitigate that, you can see when Panthera makes their appliance, they're going to remove the lingual of that maxillary, the nylon on the lingual that you typically see going along the maxillary anteriors. They're going to remove that so that appliance will typically or hopefully not create that flaring. And then I go to, if we look at the push type of appliance, this is in this particular case, the X3. If every force has an equal and opposite force, if we're pulling and now we're going to switch to a pushing device, this is now what we're used to. When we push the jaw forward, this is now the appliance that can create potentially an overjet issue where these teeth start moving. So it took me a while to kind of allow this to sink in, but as you push on these appliances and see what happens, you will see this type of effect. Decrease in overjet and overbite in the push type appliance, the herps, the wings, the X3, those type of appliances, and potentially an increase in overjet in some of these other types of pull type of appliances. Now, again, we're trying to mitigate these with appliance design and appliance selection. So if we have cases like this, we hopefully can mitigate and put these forces on these teeth to mitigate all of these issues. Okay. So to kind of sum up is Biomatch now can be done in a very quick 30-second case submission. We need your 4-digit customer number. We need to tell them what teeth are fragile, and therefore they will not engage those teeth. We're going to need to tell them what type of bite you're providing. Are you protruding them as far as possible, or are you giving them the bite at their starting point? And then what type of appliance do you want them in. Do you want a classic or an X3? That is all you need. You no longer need to go onto Panthera's website and fill this out. If you want to, you can absolutely do it. So if you're happy with that workflow, keep doing it. If you want to save some time, this is what they need to streamline that process. Once you submit it to them, you're going to get it back in 8 days, and then you have that 36-month warranty. Will replace any device free of charge. So again, one of the advantages of Biomatch and the Panthera's design philosophy is, again, not engaging, or hopefully not needing to engage, the maxillary and mandibular anterior teeth. If you need to customize them, you can customize them. If you want to put rubber bands on them, you can put rubber bands on them. But it gives you the option to customize them if you need to, but it also, if you trust them, if you trust the design principles that we talked about tonight, you can streamline that process and eliminate as many clicks as you possibly can to streamline that process to get it back in your patient's mouth and get them tolerating it, using it, and getting them breathing and therefore sleeping better. So that is all I have tonight, Dr. Carstensen. I think you have a couple questions for me.
I do. Thank you for this really informative presentation. Actually, you settled up a couple questions I had in my head, because we ordered a couple of Panthera devices this week, and my team said, this looks different. And
Yeah.
it was the Biomatch. That's how fresh and new it is. Yeah.
Yeah.
Yeah. So I have a question. This came in. Sometimes the patients have trouble getting them off the teeth, devices in general, off the teeth. And they mentioned that interproximals are an issue. They seem to be an issue. So can you talk about the balance of retention versus ease of removal? Because that bothers a lot of people.
Yeah, it's always this delicate equilibrium between the two.
Yeah.
We need them to fit, because if they don't fit, or if they're not retentive enough, they're not going to stay on there. But we also don't want to engage that undercut or engage that embrasure too much, because then it can essentially, it's that wedge effect that I talk about, where could potentially create tooth movement, create an open contact, patients start catching food. So because they have a CAD system, they can get down to like 1/100th of a millimeter to make sure they're getting enough retention on the buccal and lingual with the Biomatch philosophy, to make sure it's like Little Red Riding Hood, not too hot, not too cold, just enough retention to fit, just enough retention to stay on, but just enough retention for the patient to take it off.
I think Goldilocks is what you were
Yeah,
looking.
sorry, not Little Red Riding Hood. My bad.
That's all right. So if it comes in, some of our listeners aren't going to be as familiar with the nylon material as others, or they've had experience with some nylon materials. Is there any difference in your hands between the Panthera nylon and some of the other nylons that are
I think
out
it
there?
also comes down to design features. And like they're able to customize. If they need it rigid, they're going to make it rigid. If they're going to need it flexible and like, I don't want to say flimsy, but loose enough in certain areas, they're going to be able to do that. I know with the Panthera nylon, if it is, we can put it in some hot water real quick and kind of mold it in case we need to make some of those adjustments. Um, so it's not just, I think it's more, yes, a lot of appliances have the nylon, but I also think it goes back to their CAD/CAM design features, and that kind of go into it, and why this nylon material is a little bit more unique.
Yeah, and I know because I've been to that amazing factory in Quebec City, is that this is not really printed nylon. In fact, it is not printed nylon like some of the devices. It's called additive manufacturing because there's lasers involved.
It's not our 3D printers that we have in our office.
Right, right,
They're like industrial grade additive manufacturing.
right,
Most people just, when I say additive, they don't know what it means. It's essentially a form of 3D printing.
right. Hey, a question came in about the anterior only contact that you mentioned with the platforms in just the front. Does that add more pressure to the incisors? And is there any torquing of like the posterior teeth? they've had trouble apparently with some tap appliances that way.
Well, I think going back to that tap style appliance is where is the connector point? I think it all goes back to where the connector point is, and that is what's going to dictate where the most force is. Okay. So with the taps appliance, the connector point is not only in the front, but then also you're going to get that NTI type of edge to edge bite. Panthera is going to have the connector points still with it depends on what device you're picking here. But if
Right.
it's a classic, going to be in the canines going down to the molars, and it's just hopefully decreasing the forces that they can put on these type of appliances. The connectors are the same, but where the teeth will meet, or I won't say the teeth meet, but the two platforms meet is then in the front area.
Okay. That's helpful. Yeah. And then one somebody asked about do they have to do any special training for biomatch? I think you've made that clear, but you want to make sure that that's
Yeah, Biomatch is all done for you. That's why I think I used the easy button in the front. They're
yeah.
going to use that with on their end. They take care of that to make sure, and their the design philosophies. I don't know if it's millions, but hundreds of thousands of appliances that they've probably made. This is works best in their hands. They now have research backing them up on why they make each of these design decisions, and it all comes down to force mitigation, putting forces on the strongest teeth, hopefully eliminating or putting zero to little force on the weakest teeth.
There we go. And then one other question here. They said that they've tried some Pantheras and that little wing in the back on the lower sometimes gets in the way. So does can you talk about the scanning, the information that's needed to make sure that that mounting wing is not going to interfere? Is there something special
Are
that
we
we
talking about like the X3 type of appliance, that wing there?
the
Is
classic
that what you're referring to?
the classic where
Okay,
the
or the classic. Yeah, I mean, I think with any of the appliances that have the hinge on the external, that is a factor that you're going to run into. It happens very rarely. I call it my maxillary. Can I prep a maxillary molar on this tooth?
Hmm,
Like I think we've all had those cases where the patient opens, the ramus comes down, and it lines up directly, like, and we have zero room to get their cheek out of the way.
mm-hmm.
I think it's very far and few between when I have those cases, but that what I will like, can I prep a second molar on this tooth fairly comfortably? And if it's yes, then I think any of the appliances with the external engagement apparatus will work. Have I put in ortho wax in those particular areas to hopefully allow the cheek if I do run into it? Yes. Those are kind of some of the workarounds that I do. Or then, worst case scenario, if there's really zero room because I can't prep it or I'm going to have an engagement, then maybe we have to use a different appliance.
Okay. Yeah, that's a good point to think about. Can I prep a upper molar? What I do is when I have the patient in the George gauge, I teach them to take your finger and just push it back there. See if
Yeah. Or
there's,
yeah, you put your fingers back there
yeah,
and see if that has an impact.
yeah. If
Yeah, I
there's,
think either way would work. That's just the way that seems to work in my hands.
there we go. Okay. Um, Let me see. I think that's all the questions
Or
we had.
yeah, I mean, or maybe we use an X3 and then you move the gauge a little bit more forward and it's more in the premolar area. So you have options
There we go.
um, with either one.
Like my friend Dr. Quishan says, it's a thinking person's game.
Yes. It's a lot more detail as I get deep, like as we treat more patients with this. It's
Yeah.
always like I'm always every patient is different. I'm learning something and how to tweak appliance selection, talk to patients about this to get them to have the most optimal outcomes as we can.
And one of the things that you didn't point out so much is that with the biomatch, it's an easy way to engage with getting an order in. But if you have special questions, I know from personal experience, the Panthera people will happily
Call
connect
them.
with you.
I mean, it's an easy call, and they can go through their philosophy on why they designed this appliance a certain way and their experience behind it.
All of that. Well, Jonathan, thank you so much for joining us today, and thank you everybody for being part of tonight's webinar. We've run out of time for any more questions, but if we have any other questions come through, just please send them along and we'll make sure you get those answered. Thank you again for attending, and special thank you for Dr. Ford for taking your time and expertise to share with us the Panthera's special biomatch process. I'm sure it'll save us all a lot of time in our clinics and make our patients feel very confident about the device that they're going
The
to be.
less time I get to spend ordering, the happier I am.
And not just ordering though. I'm going to go ahead and allow you to make a couple more points, because it's not about the ordering time. It's
It's
about
not, it's
chair
it's the
time.
whole thing. Like I want it done the right way the first time. And I trust their design principles. I trust the ordering, the manufacturing, the whole process streamlines this, and it makes it efficient and an effective appliance that the patients tolerate.
Yep. You and I are both fans of Panthera. I can
Yeah.
tell that. All right. And thank you again. Good night, everybody.
Good night.